I'm a speech language pathologist finishing my clinical fellowship year. When it comes to voicelessness, I work with patients who have had a laryngectomy, so had their voice box removed and no longer have a means of communicating in the typical fashion that everyone else communicates. And with that, we work with them to get their voice back through an electrolarynx, which is a machine you hold up to your neck, or initially after surgery, there's an intraoral adapter that you use, and that uses the vibrations that you create to mimic sound or voice. It sounds very robotic, and it's hard to use sometimes. But given practice, patients can be pretty successful. Voice is kind of everything. It's really hard to express yourself without talking. And I mean, I feel like we've all had moments where even words can't do a moment justice. And so just to imagining having the words and the voice that you use to communicate every day taken away is kind of, I mean, it's unfathomable. These patients that I'm working with are incredibly resilient, and they all kind of express the same notion. Like, they don't realize how hard it's going to be until it's gone. You can imagine. I mean, it should happen never, but it happens way more often than it should, that patients do not understand that they truly won't have any voice. Speech pathologists, we also make sure that they have a means of communication set up immediately after surgery, because you can't immediately start using electrolarynx. You can't, I mean, it's at least, the average is around 3 months after surgery. You can even consider getting a TEP, which is that. So they will have to communicate for a while without any voicing options. And so making sure that they have something set out, whether it's texting, writing on a whiteboard, having a notebook. Maybe we create some type of alternative means of communication, like an AAC board prior to surgery, and then they can practice using it, ask any questions, kind of get everything out. And I think that's really where LiRA could play a significant role, being another option for communicating after, in that immediate time after laryngectomy, when you don't have a lot of different communication options like an electrolarynx or a TEP. But you still need to communicate because you're in the hospital and you just had a major surgery. You need to tell the nurse when you're in pain. You need to ask your doctor the questions that you have, ask your other care providers like a speech pathologist the questions that you have, and participate in that. And miming is not as effective as, no matter how much we want it to be, it's not very effective. And plenty of people have difficulty writing and texting. So